just how do you feel about the new Black History Month that's approaching us, and about UGA trying to engage in the local events
Well,
on campus?
that's one of the positives, I think. I mean, I've every year for a very long time, I take Black History Month myself and try to learn something new. And so I've, it's amazing to be in an environment now where people are actually doing that on an environmental level, not just me as an individual. So that makes this a great place to be. Um, do you want to hear about one of the things I found exciting?
Yes.
Okay, I read a piece in one of the local papers about the Georgia Museum of Art having a new exhibit. I am very excited to see that exhibit, and very, it's nice that this is an alumni contribution, right? Yeah, that I think speaks well of the institution, says something about its alumni's connection. So I'm looking forward to taking that in.
Okay. Sounds great. Now, all right, since you have obviously a great past because your job position here, would you be willing to tell us about any of your personal contributions to Black history yourself, such as any publications, experiences, etc.?
Oh, yes. Well,
Okay.
academics love to talk about their work. You're probably very familiar with the Tuskegee Syphilis experiment. No,
Okay.
maybe
I
not.
think
Briefly, there were a group of servicemen who came back from World War One, and in 1932, the U.S. Public Health Service began to follow them. They were diagnosed as having syphilis, and so for the next 40 years, the Public Health Service followed them and did not treat them. And it's known as the Tuskegee Experiment. You can find lots and lots of writings about it. There was a book called Bad Blood. It was uncovered in 1972 by a scientist at the CDC who basically found out this was still going on and put a stop to it. Bill Singleton is his name. And Clinton actually apologized for the injury that was done to the men. I mean, this was really very bad, very unethical, not a good example of science, and it wasn't even based on a good premise. Well, my question, and I worked with a medical historian at Penn State University, Dr. David McBride, we were interested in where the syphilis came from in the first place. Well, not exactly where it came from, but what were the conditions that set into motion this outbreak of syphilis that happened in the early part of the 1900s in the African American community in the United States. And so by combining my experience as an epidemiologist and his experience and expertise as a historian, we were able to identify where that basically World War I ignited a syphilis epidemic that lasted for 40 years in the United States. Not just blacks, although blacks were disproportionately affected by it. Any serviceman who served in France during World War I had the potential for having syphilis. Now, the thing you have to understand is at the time, there was no real treatment for it. So part of the reason they were doing the monitoring is to see what happened to people who had it. But the ethical scandal was that treatment became available and it wasn't offered to these men. So they continued to have the ravages of syphilis, which are pretty intense. So our contribution to Black history is that we were able to take a dispassionate look. We pulled the lens back on time and said, okay, what started syphilis outbreak in the first place? And what we came to understand is that social disruption. World War I was basically a war. Anytime you have social chaos, the potential for a sexually transmitted disease outbreak is always possible. And so it was a history lesson, not only for African Americans in the United States, but that lesson continues to propagate itself in time. Anywhere you have social chaos, you will see this same pattern of people with high rates of STDs. And so when we did the analysis, we looked at military records of people who were inducted into the Army for World War One. And it was clear that they screened, they took the healthiest, the strongest, guys 18 to 30, I call them the most marriageable, and sent them into an environment that was chaotic and where sexually transmitted diseases could flourish. So, contrary to popular belief, the government did not give them syphilis. That's important too, because I know I've talked to other professionals who study this, and a lot of people mistakenly think the government gave them syphilis. No, they got it the way people usually get syphilis.
Okay, that was really interesting. All right, could you speak on your new book?
Sure. I spent a year working for the United States Senate Finance Committee during healthcare reform. I was a staffer. Senator Max Baucus is the chair of that committee. And so I was part of a big team of people who helped to craft the Affordable Care Act, which is now law. And so one of the things I was struck by was its potential to address health disparities for all groups in the United States, for racial and ethnic groups, for poor people, for regions in the country. And so I sat down and took all 10 titles. I know that bill probably better than a lot of people in this area. Had a chance to analyze it, and that book is coming out in May of this year. It's published by ABC Clio is the publisher, and it's now available on Amazon.com. So you could order it in advance if you need to.
Okay. And the Affordable Care Act, you said?
Is the name of the law.
Okay, and what is that, just briefly, what is that law?
People call it healthcare reform.
Okay, healthcare reform.
The people who are not happy with it call it Obamacare.
Okay.
So you may hear it referred to by all those names, but its official name is the Patient Protection and Affordable Care Act of 2010. Public Law 111-148.